This is Michael Smith of MedPage Today. I'm at the conference on retroviruses and opportunistic infections in Boston. I'm speaking with Dr. Connie of the University of Washington, who has been investigating an aspect of HIV acquisition. That is to say, the susceptibility of people who are infected with herpes simplex 2 to HIV, and has come up with some untoward results, I think. Dr. Celum, can you first of all describe what the relationship is between herpes simplex and HIV?
So the data from the last 15 to 20 years suggests that people who have HSV2, which is the most common cause of genital herpes, are at increased risk of becoming HIV infected by the order of 2 to 3-fold. The reason why we think that happens biologically is that when herpes reactivates, there's often small breaks, sometimes not physically apparent or symptomatic, but that the herpes virus reactivates fairly frequently and creates an easier portal of entry. In addition, it appears that the target cells for HIV are recruited to the genital area during herpes reactivations. So that's the both epidemiologic and biologic data that suggested that genital herpes was an independent risk factor for HIV acquisition. And based on that, we also have data from mathematical modeling that suggests that maybe a third of new HIV infections in Africa could be attributed to HSV2 infection.
So with that in mind, you set out to see if you could intervene in this process. What did you do?
So we did a randomized placebo-controlled trial that was double-blinded, meaning neither the participants nor the investigators knew what they were randomized to, and enrolled 3,277 HIV-negative, HSV2-positive men who have sex with men and women. A little over half were men who have sex with men from Peru and the U.S., and the remainder were women from 3 sites in Africa. Once they were enrolled, they were randomized to either receive twice-daily acyclovir, the standard dose for herpes suppression, or matching placebo. Then they were followed for monthly for 12 to 18 months, and during that time received counseling, free condoms. If they had symptoms of herpes, they were eligible to receive a short course of episodic treatment for herpes, and then on a quarterly basis had HIV blood levels or HIV tests drawn.
And you found, unfortunately, some surprising results. What were they?
No, there was no statistically significant difference between the HIV acquisition rates in the acyclovir and the placebo arm. And however, we did see a reduction in genital ulcers, so the acyclovir drug did work in terms of having an impact on herpes, but it was not enough to reduce HIV. And putting this in context, it had less of a reduction on genital ulcers than in prior studies with the same dose.
So is there a clinical message here for physicians who are perhaps treating people at risk for HIV who are herpes simplex positive?
Yeah, well, I'd like to make 2 points. Really, one is that what we asked about was the interaction between HSV2 and HIV susceptibility. So for that part of the interaction between these 2 viruses, we would say that this standard dose of acyclovir, which is presumed to be the optimal dose based on a number of prior studies, does not add to protective effect against HIV. So you can't, with this approach, we have not been able to demonstrate that it adds protective benefit. That's different, however, than the other side of the equation, which is that HSV2 appears to increase HIV infectiousness and disease progression. And that is a separate question, probably a different mechanism, and there's quite a bit of prior data that suggests that you can actually reduce HIV levels in the blood and the genital tract by suppressing herpes. Is that enough? The real question there is that enough to either delay the time to when people need antiretrovirals and or to reduce HIV transmission? We have another study called Partners in Prevention that is asking that question, and we will have data from that trial within a year.
Fascinating research. Thank you very much, Dr. Celum.
You're welcome.
I'm Michael Smith, MedPage Today.